Welcome to Dina Mina show as a part of Digital Health Days 2015. Mina and I are very much thrilled and happy to have our next guest in the studio, medical doctor Bill Crounse, Senior Director Worldwide Health, Microsoft, a person who made his personal journey from being a family physician to one of the executives of the leading software company. Welcome.
Thank you. It's my pleasure to be here.
So Microsoft is a leading software company that doesn't necessarily offer out-of-the-box healthcare solutions, but yet Microsoft is working with healthcare industry. So what does Microsoft want to achieve with that?
I think with healthcare, Microsoft wants to achieve what it achieves across really all industries and in the consumer space. You know, Satya Nadella has talked about the new Microsoft, the mobile-first, cloud-first world, and empowering people everywhere to do more. And that plays out to everything we're doing in healthcare as well.
So just to follow up on this question, what role would you see for Microsoft the best to take in this new digital healthcare world?
Well, one of the things I'd like to point out, because people get confused about what we do in healthcare, and so sometimes I'd like to explain first what we don't do. We're not a EMR company.
No.
We're not a hospital information system company. We don't build those kinds of solutions. It's not a good business for Microsoft. Largely what we do in health is, first of all, there's a huge opportunity for healthcare systems, hospitals, clinics, organizations to take advantage of the same powerful productivity, collaboration, analytics, mobile solutions that are used in any industry and apply them to healthcare. It always, and I, in my keynote today, talked about the fact that if only healthcare workers had on their desktop and knew how to use the same tools that I use in the way I work with my colleagues, this idea of from anywhere in the world on any device being able to reach out, know who's online, who's offline, what their area of expertise is, what teams they belong to, and reach out by message, mail, voice, video, multi-party web conference with a couple of clicks. That's unheard of in healthcare, and yet healthcare is a business of communication and collaboration. And so that's where I say, to one part of that answer is, first of all, the healthcare industry needs to, and we need to do a better job of helping them use these commodity tools that are used the world over, whether it's analytics, productivity, collaboration, mobility, etc. Being a company that's both prominent in not only the enterprise, but in the consumer space, we also want to help consumers in the way they communicate and collaborate with healthcare. And I think that's one of the beauties of working at Microsoft is we truly do have a foot in both camps.
And this is also great to mention that now it's a lot of digital health entrepreneurs watching and following us.
Sure.
And for all those people, it's really curious to know, does Microsoft support growing digital health community in some way when it comes to entrepreneurs, innovators?
There are a number of ways to describe support. I wouldn't want to say that we are ready to, or a company that runs out and invests in every startup that we see. That's generally not what we do. And in fact, I will tell you, naturally being in my position at the company, I get a lot of inbounds from startups and small companies, and it's like, how do we work with Microsoft? And if only Microsoft would do X, Y, Z, we would be successful. And I generally say, it doesn't matter whether it's Microsoft or Google or Apple or IBM, generally large established companies, we have resources that are online, that are available, we have partner resources and so forth, that we can make available to help people understand how to work with and how to take advantage of some of these things. But you know, you're not going to get a lot of hand-holding and TLC from a big company like, not just Microsoft, this would be true of all the companies I mentioned. Instead, the challenge for people in the startup space and entrepreneurs is, I always tell them, go out, prove that there's a market for what you're doing, get real customers, start driving real revenues. If in fact you want to work with Microsoft, ideally be using some of our technology in getting those customers and driving those revenues. And as that cycle starts, that's when to come to us and say, look what we're doing, this could work with your technology. And then somebody like me says, let's start paying attention to what these guys are doing. And we start shining, I mean, at the very least, I can start shining a very bright light on this, and suddenly there's the world audience, and suddenly the cycle starts going like that. That's the way to work with a big company.
Everyone should note down something.
Let me also quote something that you mentioned. You mentioned that technology is mature and ready, but the people's behavior need to be changed. So what is your vision to change people's behaviors?
Yeah, sometimes people misunderstand what I'm saying when I say behaviors. I'm really talking about a rather broad spectrum of it includes everything from the regulatory environment to behavior to culture, meaning it can be the difference between digital natives and not.
Yes.
So if you look at, I mean, healthcare is by nature, and rightly so, a conservative, rather slow-moving industry. I am encouraged by young people who are coming now full circle into the industry. They've grown up with technology. They don't know a card catalog from a typewriter from a, right? They grew up with it. And they're bringing that knowledge into the industry, and they're challenging. And I think that's a good thing. In fact, nothing frustrates me more than when some powerful dean in a medical school will say to a medical resident, no, that's not how we do it. This is how we've always done it, right? We need to be encouraging and listening to these younger people and some of their ideas. I love it. I often hear people in our hospitals and health systems who are training programs today, they'll say, well, our residents come in and they look at our Epic or Cerner or name your EMR, and they go, why does it work like that? It needs to work more like Twitter and Facebook. Well, okay, that's perhaps an oversimplification, but that is the expectation that people have, the way technology should serve them, and I think we need to be listening to that.
So just with time and allowing these people to take over, things would get better.
Yes, I don't think we can wait for that. But one of the things, I mean, if there are some gray-haired people like me watching this video, one of the things I would say to them, if you're in hospital administration, if you are a clinical leader, one of the most frustrating things for me is I do a lot of board retreats and things at the executive level, and you know, you look out in the audience and it's a bunch of people like me, and we're planning future hospitals and future healthcare, and I'm like, where are the young people whose future we're talking about, who understand digital and social and crowding and crowdsourcing? You know, these are the people that need to be at the table collectively working with us on the future.
Yes.
Absolutely.
Right?
Yeah.
Let's embrace them.
We wish you best of luck with tackling this challenge and also bringing new products for healthcare, trying to modernize it in a very fast and efficient way.
Well, thank you, and thank you for the wonderful audience here and the creativity.
You again in Stockholm.
Yes.
Thank
See you at Digital Health Days 2016, and thank you for being here.
Thank you.
My pleasure.